could point to the example of Denmark, which has really developed itself as a host nation for innovative companies. And companies like Coloplast and Novo Nordisk were able to use their home market in Denmark to prototype and rapidly develop their products for commercialization globally. So it's been a very successful model. So with that, I'd like to turn it over to Bill to talk about, with all of this background, how is he going to make it happen here in Ontario? Bill?
From Neil's introduction, the expectations are really quite low for this role. Boy, this is really loud, and we can turn that down, because I'm going to talk louder than this. So anyway, look, I'm a big fan of managing expectations and exceeding them, and as you can see, I've really cocked this one up. Before I talk a little bit about the role, the one thing that fascinates me every time Neil and I are together in the same room is, without exaggeration, 10 years ago, Neil and I were together in an initiative called the Canadian Health Innovation Partnership, and there are a couple of you in the room who will remember that, which was as simple as building on a doctrine that came out of a guy called Henry Fraser in Winnipeg that at the time said $155 billion was the federal and provincial combined spend on healthcare. And we really should be looking at that as something other than a line item, as a cost center, you know, a cost of delivering goods and services to the citizenry. It really should be seen as a job and wealth creator, an economic driver. And we couldn't have that conversation. I mean, there are things that survived that effort. It was the idea was to get federal government, provincial government, research, academia, public, private sector around a virtual, if not literal, roundtable. And the Public Policy Forum, we had a great day with them, and it lives within the Conference Board of Canada. But to be brutally honest about it, I don't think Michael was there at that time. But the conversation would roll along with ministries of research and innovation and economic development and colleges and universities. And Quebec kind of got it, of course, because of their link for quite a while now, for decades, between economic policy and health policy. And you would run into a wall at health. Health would want no part of that conversation. And if anyone really wanted to clear the room, they'd just raise the specter of U.S. private sector healthcare delivery, and everyone would go, oh, and they'd run for the exits, and we'd free up time in our calendars. We spend $212 billion in this country on healthcare, according to CIHI, just public, frankly. And I've now come back from 3.5 years in London, where I led a global team for a global pharmaceutical company and spent a lot of time within integrated healthcare systems around the world. There's not another country in the world that would spend that much money in an industrial sector and not expect it to be an economic driver. It doesn't happen. And it's not just the big bad Americans, it's the Brits who celebrated their national healthcare system with a long segment in their Olympic opening ceremony. It's the French, it's everybody else. So, you know, Neil and I have been doing this for a long time, and it's really exciting that I have this job. All right, that is all for preamble. So when I was with Michael, it was well within the first 90 days, I think, and I walked into an empty office, no furniture, no people, got gifted by secondment, Jovan Matic, who was the secretariat for the Health Innovation Council, and without him, I don't think I would be standing here. Without Neil, I certainly wouldn't be standing here. Without Jovan, I think I would have died about 3 months ago. But I think we have made progress. You know, the first 90 days was really about, frankly, landing on a priority, a set of priorities that supported a purpose or a strategy. It also was really organizational development 101. I mean, we needed to know what skills and capabilities we had to have in place to execute that strategy. We needed to have a structure in place, and we really needed to know processes. Processes not just within our own team, but also, of course, within government. I mean, how do we manage the various requirements on us within the Ministry of Health in which I reside? Fill-in joke here. But then also, and this is where I spent most of my time, it was outside, getting out of that office. I think we counted 3 days of the first 90 where I had spent the entire day in the office. Because we will succeed or fail based on our ability to engender collaboration in the health ecosystem within Ontario, with ministry colleagues, with folks on the outside, innovators and entrepreneurs with healthcare providers, all of those with ministry folks on the inside. And there's no way I was going to be able to do that without having started to establish relationships of trust, and you don't get to that point if you don't start to build relationships, and you can't build relationships unless you actually spend time meeting people. So that's where I spent a good chunk of the first 100 days. We now have crystallized a clear purpose for our work, a core set of priorities. There are certain things that have emerged that will certainly guide us in our work, and I'll give you a couple of examples of areas where we're going to focus, and then I'll stop, because I do want to leave all that time for questions and answers, and I'm happy to hear from anyone and fill in the details as we go. The purpose will sound really familiar to what Neil articulated came from OHIC itself, and that's namely to drive collaboration across the healthcare system to accelerate our adoption of new innovative health technologies and processes with 3 objectives: improve patient outcomes, that's in accordance with the ministry's patient-first strategy, add value to the system. It's not 1970s central planning. We need to have cost-effective technologies brought into the system. And thirdly, and this is what distinguishes us from so many other smart, hardworking, passionate people that we're lucky enough to have working in the health and innovation space, and that is to create jobs in Ontario. So we double underline that third bit. Council members really reminded me of that when I took the role, and I totally get it. And as I said at the beginning, this is a passion of mine. I've been working on this for a very long time, and I think that we are poised in Ontario to really do something special in creating a health technology industry within the life sciences industry, which might be the fastest growing and biggest job and wealth creator in the world in the 21st century. The priorities I told you about, those will look familiar too. Pathways. So Neil told you a lot about the pathways, and similarly the second priority, procurement, so I won't belabor them here. But that first item, the notion of pathways to the adoption and scalability, or adoption and diffusion of innovation within the system. We have the incredible luxury of being a single-payer system. I believe that from a delivery perspective too, but from this perspective, think of the pull that could create. I mean, in theory, there is a single lever you could pull and just do stuff if you wanted to. Now, it's not that easy, and there's 100 reasons why you wouldn't do that. But in theory, the big benefit of a monopsony, a single buyer, is if you get that person or that entity going the right way, it can be immensely powerful. So as the council discussed, our view is one of the 5 core things we're going to be working on, and one of the overarching priorities will be to get those barriers out of the way, to create that pull through the system, to provide that access, and ultimately the scalability that Ontario companies are going to need to grow. That'll quickly get you to procurement, and Neil spoke about that also. It might be the biggest issue, and for some audiences it's not particularly sexy, but I think in this one you'll appreciate it when we say that we could get everything right on pathways. I use the Soviet Constitution metaphor, right? I mean, or I guess analogy. I mean, Soviet Constitution was a terrifically written document. Its execution left a little bit to be desired. And so we could get everything right and write everything right as far as processes go on pathways to the adoption and scalability of innovation if we do not have a procurement system that is value-based procurement or strategic procurement that is more sensitive to the fact that Ontario SMEs are never going to be able to generate 200 pages in response to an RFP requirement that takes 72 days to turn around, and for which they probably didn't qualify in the first place because hospitals increasingly are bundling goods and services together to allow them to do fewer procurements. Look, it's a big pie, it's a growing pie. There are lots of pieces that can be made available to these growing and really exciting Ontario health technology companies that Neil started to describe. So there's a big piece of work called the supply chain management review process that's underway, and there are other things that we'll be doing to really try to get our arms around the procurement issue. My job reports to health, as we said at the beginning. And that's really exciting for me. What's even more exciting, perhaps, is I have a formal dotted line to the Deputy Minister of Economic Development and Innovation, and a formal working relationship with the Deputy Minister of Government and Consumer Services, within which procurement lies. So that notion of already structuring my role to get across the silos was really important, and I think will be valuable on procurement. The third priority is to provide better care closer to home. This is the number one priority of the system, home and community care, and our lens on this is how can we help that through the use of enabling technologies like digital, mobile, and virtual health. The fourth priority is looking at the next generation of consumer e-health. It's really digital health for the consumer. How can we, so again, that's a big piece of work. There's lots of people working on it. Our lens is how can we build the tools and the capabilities and the partnerships with Ontario companies such that we are empowering Ontario patients through digital health, and as we've talked about all along this morning, grow the economy at the same time. And lastly, the one that might be most exciting and perhaps most daunting is the opportunity to improve patient outcomes in Aboriginal health through the use, again, of the types of technologies that we're talking about. So that's the list of priorities. That's pretty linear. I said from the beginning, I would have said this to Michael early on, we'll have a shorter list of priorities rather than a longer list. There are lots of things you don't see up there, and that's intentional. But we also think of it as a little bit of, there's some method to this madness, right? I mean, if our ultimate goal is those three objectives that I described early on, so improve patient outcomes, value to the system, and jobs in Ontario, there really are two overarching priorities on pathways and procurement, and then within which there's specific areas of focus that we describe that, if we do things right, we'll end up with better care closer to home, empowerment through digital health, and enhanced Aboriginal health as a result of having worked on the pathways and the procurement issues. So that's the way we think of priorities. There's certainly going to be other things that will come along that we will want to take advantage of opportunistically, but that is our organizational thought when it comes to the work that we're going to focus on. Because again, as I've said from the beginning, we will measure ourselves by the impact we have, not by the activity we generate, not by the number of panels I appear on or the speeches I give or the meetings we host at the office. We're going to try to move the needle on those three purposes, and we will be able to announce metrics to you quite shortly. All of that is built on a foundation of collaboration, and that's why that bottom piece of that pyramid is so important. Again, as I said at the beginning, we're not going to get anything done unless we can get people to play with us and with each other. I love the sandbox metaphor, and that's what I feel our role is. Really, we're a catalyst. We're not out to create another entity that sits alongside the, I think, 70 or 80 innovation centers, incubation labs, et cetera, that exist in Ontario. We don't need another one of those. And so our view will be really that our role is to be, as a catalyst is to help people work better together so the whole is greater than the sum of its parts. And those are some of the themes that have emerged as our work has unfolded. So you've heard me talk about the health tech innovation ecosystem. So that's our goal. Like, we want a health innovation ecosystem. We're not out to run a mini Dragon's Den. You'll hear shortly about the fund that we have, and it's an exciting fund. I mean, we'll have $5 million a year, and it's going to be really important to collaborative units that come forward and ask for our money. We won't give it just to companies. You'll have to come forward with a healthcare provider and a researcher or a clinician and put the offer forward as to how either at the prototype phase or the evidence generation phase, this amount of money will help by engendering the type of collaborative behavior we're looking for, and ultimately lead to evidence generation, first customer Ontario, those kinds of things. Scalability, scalability, scalability. We have lots of startups in Ontario. You can always have more startups. The broader the base of the pyramid, the greater the chance of success at the top. But our challenge is to get those companies in Ontario that have 5 employees to get to 20, from 20 to get 50, 50 to get 200. And so lots of what you heard Neil talk about and what we'll be focusing on is how to grow Ontario companies.